On that note, I will ask for our guest to be put on screen. Fabrizia, are you connected?
Yes, good morning. Can you hear me?
Fabrizia, we can not only hear you, we see you. A good connection. So, Fabrizia, welcome. As I mentioned, Fabrizia Falcione is UNFPA's country representative in Sudan. She's in Khartoum. So, Fabrizia, over to you, and then we'll take some questions.
Thank you. Can you hear me?
Perfectly.
So, good morning from Khartoum. Here, women and girls across Sudan are telling a consistent story of continued experience of danger and risks where gender-based violence is their present daily lives. Along the road as they try to flee from the active conflict as well as they arrive in the displacement camps. No matter where, they feel unsafe. And it's not about a few incidents or a few locations, and this is confirmed by UNFPA assessment on protection from gender-based violence that was conducted recently with 95 focus group discussions across 16 out of 18 states in Sudan, comprising of around 1,000 women and girls. And the results are very clear. Women and girls have a persistent sense of danger. 76% of the women aged between 25 and 49 have reported feeling unsafe in the displacement camps and sites, but also outside the camps, in markets, water points, in firewood collection areas, roads and streets, particularly at night, when going to the latrines in distribution areas, and equally in urban and rural areas. Now, the majority of the women that I've met during my visits across Sudan, in northern states, White Nile, Blue Nile, in Khartoum, they've lived under shelling and the active conflict for many months. They've been displaced. Many of them have been displaced multiple times, including up to 4 times in these 3 years of war. And all of them have suffered enormous violence or witnessed violence being suffered by their families and community members. Clearly, for them, they clearly say it, the road to safety is actually not safe at all. And along the way, they face harassment, sexual violence, all types of physical violence, shortage of food and water. And in the areas of displacement, as I was saying, they continue to feel unsafe. I've visited camps across Sudan, and the majority are clearly women, girls, and children. You see them that they are in the open air waiting for shelter to be allocated to them, living with a number of other families. The women, including the pregnant women, having to walk at night inside the camps, completely in the dark, trying to reach latrines. With no lighting at all. And I'm now in Khartoum. It's dark here. The city is completely dark at night. If I had to go out and walk at night, I definitely would know what the sense of unsafety and security that they are seeing and feeling. Now, the reporting cases of gender-based violence remains extremely difficult, as the assessment that we've done reports. And this is due particularly to stigma from their families, the communities, the fear of retaliation, the financial constraints, as well as the distance from the service provision. Also, when we asked women what is it that they need the most, 3/4 of them have indicated as economic empowerment and livelihood as being their priority. And I can confirm from all my missions that women want to return, including to Khartoum. They want to return to their homes, to their areas of origin. They ask for 3 things when I've spoken to many of them: basic services, access to health, access to schools, particularly for their children, and livelihood opportunities. They don't want to be fed. They want opportunities, income generation activities, opportunities to be able to feed their families and their children. And here, for us, it's very clear what the women are asking. Now, the issue is whether the response and the funding allocated follows what the women are asking for and what their needs are. Today in Sudan, the protection sector is funded at 14% and the health sector at 11%. We keep hearing over and over that this is a protection crisis, particularly affecting women and girls. It is a health crisis, and yet the funding are not following neither the definition nor the needs that are being identified. As UNFPA, we are running 88 women and girls safe spaces across Sudan. They're called women and girls safe spaces for a very good reason. This is where women find the courage to speak up, to talk about the violence that they've suffered, to seek for help, and to receive the services that they need the most. And yet it is very difficult to continue sustain these services because of the funding gaps. And as a girl said recently, she said, "Here I feel safe. I'm spending time with my friends again, just like before the war." And I think that this is a very important message that the world should hear for really for supporting more the crisis in Sudan and not abandoning Sudanese people. Thank you.
Thank you very much. We'll take some questions. Edie, please.
Thank you very much on behalf of the United Nations Correspondents Association for doing this briefing. My name is Edith Lederer from the Associated Press. Have either the government or the Rapid Support Forces ever taken any responsibility for sexual violence by their soldiers and fighters? And has anyone ever been prosecuted?
So as you know, UNFPA provides response services across Sudan as across humanitarian crisis to women and girls suffering from gender-based violence, including sexual violence. I would actually leave this response to the colleagues who are working on it, as this is not really UNFPA, part of UNFPA mandate. We are working on conflict-related sexual violence together with the other actors on the ground, including with the USG Office on Sexual Violence in Conflict. But the specific question, I think, should be answered by others. Thank you.
Thank you. Yes, Namo.
Thank you. This is Namo Abdullah with Ruda Media Network. Yesterday, the WFP introduced us to a new map which shows hunger around the world live, basically a live interactive map. And the map shows that 41% of the Sudanese population are in crisis, in food, worse food insecurity or in crisis, basically. I just want to know if there's a story that you can share with us to basically put a human face on these numbers. Since you are in Sudan, have you talked to people, anything that you can share with us on the starvation there? Thank you.
Sure. I mean, clearly, the women that we meet, that I meet, and have fled from days and days and weeks of violence, including just by walking on the roads for weeks until they reached safer places like displacement camps. They have suffered, and they report, and it's visible, of malnutrition as well as lack of food and water. And they say it. That for them and for their children, they go without food and water for days. This is something, it's part of the larger, obviously, crisis that Sudan is living. And I think it is important that we highlight all the different suffering and crisis that this country really has. So for us, when we receive women, these are women that have gone through, as I said earlier during the briefing, not only a food shortage, water shortage, but also enormous rates of sexual violence. So you put everything together, the burden that these women in Sudan have been suffering along all these years is just enormous and unbearable.
Thank you very much. Any more questions? Thank you very much, Fabrizia. We really appreciate it. All the best to you and to all your colleagues in Khartoum who are doing amazing work in, as you say, extremely, extremely challenging circumstances. So please take care of yourself.
Thank you, Stefan. Thank you all.
Ciao,
Bye.
grazie.